Hello. According to the Centers for Disease Control and Prevention, year over year for approximately the last 2 decades, from 1999 to 2017, there has been an increase in death rate related to this. I'm speaking about our nation's opioid epidemic. While I have a role in the medical community, I'm exposed to the opioid epidemic more as a citizen than I am as a nurse. I worry about my children, my husband and I as medical professionals, the patients that I care for, and everyone else as it relates to this epidemic. All of the sources selected for this material were carefully done. The opioid epidemic is unbiased. It can affect anyone. Therefore, we all need to be cognizant of it and what we can do to eradicate it together. This is a major societal concern across our nation, and we must all work in a unified approach to fight against it. To do so, it's of utmost importance that we understand what is fueling the epidemic, what are some of the drugs that may be being abused, what the trend of the epidemic is, and what is being done to combat the epidemic. First, we'll discuss ways in which the society is contributing to the epidemic. According to DERS and the CDC, prescription painkillers are a major contributing factor. In fact, from 1999 to 2016, prescription pain medication quadrupled. According to DERS, opioids are prescribed at a significant rate to treat non-cancer related pain. 1 in 5 patients who have non-cancer related pain are prescribed opioids. Overall, there's been a lack of caution in prescribing, as well as an inconsistency in monitoring patients who are prescribed opioids. Next, we'll discuss drugs related to the opioid abuse. When you hear about a drug overdose, do you automatically think heroin? You need to think about both prescription and non-prescription agents. According to DERS, the daily death toll related to overdoses related to prescription opioids is 40 people per day. In Morbidity and Mortality Weekly in the years 2015 and 2016, the largest increase in overdose-related deaths was related to synthetically manufactured opioids, such as illicitly manufactured fentanyl, or IMF. I'll then ask you, have you heard of carfentanil? According to the DEA, carfentanil, a synthetic opioid, is one that is used typically to tranquilize large mammals. It can be disguised as heroin on the street, and it is 50 times stronger than heroin is. You should be aware that if you encounter this substance, not just as an abuser, but as anyone, it can have deadly consequences. We'll then explore the trend. While the chatter has quieted related to this nation's opioid epidemic, that's only because I feel as though we have become desensitized to this matter. According to the CDC, between the years of 1999 and 2017, the United States has lost 750,000 people to this epidemic, with greater than 1/2 of those overdoses being related to opioids. In fact, in 2017, 68% of all the overdoses were opioid related. As previously stated, there are 40 deaths per day related to prescribed opioids, and if you approximately triple that, there are 130 opioid-related deaths per day. According to the CDC in the Commonwealth of Massachusetts, both at a national and a local level, these numbers are not trending downward. We will last discuss efforts put in place to combat this. Well, according to Pitt and Associates, while decreasing prescriptions can be good, it can also be problematic in that people may seek these agents elsewhere. However, our hand is being forced. According to Parker and Associates, 50 states have implemented drug monitoring programs as well as Narcan or naloxone laws. They have also implemented changes in prescribing. In fact, Massachusetts is one of the first states, or the first state, to set a prescribing limit of 7 days. Also, providers are being educated on appropriate use of opioids. Lastly, the Plymouth County Drug Task Force, with the Plymouth Community Outreach Program, provides follow-ups to those who have overdosed within 12 to 24 hours of overdosing. It is my hope through hearing this information that it is either provided a review or provided new information to you on the opioid epidemic that the United States faces. In this brief educational opportunity, we have talked about factors that contribute, substances that are being abused, the opioid epidemic trend, as well as what is being done to combat it. After listening, I hope you have an increased sense of awareness and feel as though you can contribute to this effort to fight against this epidemic. As we close, I ask you to think about ways that you can lend a hand. Thank you.